Welcome to session 3 of module 8. We're going to be talking about bereavement care in the final hours and after. Care following death takes time and sensitivity in regards to not only the deceased but also to the family. So prepare the family. Following death and pronouncement, family may feel numb and confused about what to do next. So in a quiet and private place, the nurse really needs to explain the process and procedures for care of the body immediately following death. Families may wish to engage in postmortem care and they may not, so that offer needs to be extended, and whatever they decide is what is best for them and should be respected. So care after death, removal of all tubes, medical supplies, and equipment. However, an important thing to remember, this is absolutely critical, and you will see this on the test. This is a freebie. Unless you should know whether or not this case is a coroner case. So if someone dies, especially if it's unexpected, sudden death, if there's going to be an autopsy, you do not remove any tube or drain from the body. So you will wash the body, you will redress the body, you will still provide postmortem care with the exception of removing lines, tubes, and drains. Very important to remember. In any case that is not going to have an autopsy, you will remove those lines, tubes, and drains. You will do a bed bath, you will redress, reposition the body in a position that's respectful for patients. So typically that's going to be lying in a bed, maybe the hands on the chest, maybe at the side. One of the things that is important to remember is that the body is now relaxed. That means that sphincters are no longer contracted. That means that the jaw is going to drop open. So provide that pericare within the bed bath and put on a clean brief that will be able to catch any fecal matter or urine that passes through the body, because it's going to pass through the body. It's no longer to be held in place by sphincter tone. One way to address the jaw falling open that can be very distressing to patients or to family members, taking a washcloth, rolling it up really tight and placing it under the jaw helps to keep that jaw closed, and it's not hugely prominent, so it's not going to be something that's incredibly distracting or distressful to the patient or to the families. Sorry, I keep saying patients. I'm so used to that. At this point, the patient is dead. You're being respectful to the body, and you are cleaning the body, putting it in a position that is not distressing to family. So place them in the proper alignment. If they have dentures, put the dentures in. If they have hair, then brush that hair, try to make it look as best they can. Know from the family if the family wants them dressed in a certain outfit, and then know the plan for burial or cremation and where the body is going to go afterwards. And then provide as much time as you can for the family to say goodbye. Consider the environment where the family is saying goodbye. So if there's a lot of medical equipment, maybe there was a ventilator or IV poles, remove any of that. If it was some sort of traumatic injury, be sure to remove any blood from there, any bandages. Just clean up as best you can and take out everything that's not necessary. So make the environment as peaceful and inviting as you can. As far as culture, some cultures have practices that dictate the care of the body after death. So be sure that you know if that is important to the family, or if there's a specific person that needs to care for the body after death. So the goal is to provide a clean, peaceful impression of the deceased to the family. So remember to assess and honor and advocate for different cultural practices. In all things, it is critical to be respectful to the body. So once a patient dies, the actions of the nurse should show not only excellent care of the body, but be highly respectful. Before the patient has died, the nurse should have already spoken to the family to find out what different rituals and traditions are important at this time. If the patient dies in the hospital, like I said, get the room clean as soon as possible. If the patient dies at home, the family may want their loved one's body to remain in the home until friends and family can arrive. Family may want to take pictures. They may want to cut a lock of hair. Just be sure that you know what it is that the family needs, and be sure to respect and honor different rituals that the family would like to occur at this time. This video, if you would like to watch it, it's talking about the pause, just a brief acknowledgement that a death has occurred and acknowledging what the healthcare team has done for the patient in this time. Again, death, it takes a toll on everybody, and whether or not you know the person, it's important to honor your own needs as well as the families. And so the pause is kind of a neat way to just take a moment to acknowledge a patient, acknowledge a family, and acknowledge the healthcare team. Follow-up bereavement support, whether it's a phone call, a card, attending a funeral, it's often helpful for the family as well as the nurse. A lot of times nurses have this continued relationship with the family and the patient who died, and attending a funeral is not inappropriate at all. It may be very healing to the family and the nurse as well. I spoke with a nurse who worked in pediatric oncology, and she said there was this one patient in particular that she cared for I believe it was 3 years. And that was the longest she had ever cared for the same patient. And when the patient finally did pass, she had a really deep relationship with the patient and with their family, and they invited her to attend the funeral and the party afterwards. And she didn't want to be rude, so she did go, but she found that not only was it respectful to the family and meaningful to the family, it was also very healing for her. And she was really grateful that she was able to show the family support, but she was also able to attend to her own needs in attending the ceremony. The death of a parent can be traumatizing to a child regardless of the age. So members of the interdisciplinary team need to be cognizant of the needs of young children if there is a death of a parent. And this conversation should be geared to the developmental stage of the child and should be communicated with openness and honesty. It's important to give time for information to be processed by children, to give them the opportunities to ask questions, to answer the questions according to how the child can comprehend it. And remember, it's developmental stage of the child, not age of the child. Adult children also grieve loss of physical and emotional strength of their parents. Adult children, they usually have other roles. They're working, they're caring for their own children, they're maintaining chores at the house. They may feel guilty for not being able to spend enough time with their ill parent. So these are some of the needs that may need to be, bereavement needs that may need to be addressed for adult children. And then grieving grandparents as well. They experience double grief. So as they watch their grandchildren suffer the loss of a parent, they suffer their own loss of their child. They experience grief, and it's important to remember the grandparent as well. Nurses have a very unique role of being with the patient in the last moments of their lives. They have the opportunity to assist the family in witnessing a good death. Families will always remember those last moments. So as nurses, we can provide excellent physical assessments, manage those physical symptoms, manage and attend to psychological, emotional, social, and spiritual needs, honor cultural practices, rituals, and ceremonies, prepare the patient and the family for death, communicate with the family, with the patient, with the interdisciplinary team. We can listen, we can provide presence, and we can bear witness to what is occurring. So care of the patient and family as death approaches, or as the time of death has passed, it's a very unique dimension beyond those seen earlier in the terminal illness. So close collaboration with the interdisciplinary team and recognition of individual patient and family needs are essential. And as we wrap this up, remember that every encounter with a patient and their family is cross-cultural. So the interdisciplinary team should work to be flexible, sincere, and ethical. There's no one size fits all. There's truly no typical. Everything is individualized. Each experience is individualized and unique. So effective care depends on heightened sensitivity and awareness to the social, cultural, psychological, and spiritual needs throughout the illness trajectory. So that wraps up our final discussion in the final unit. This is all very heavy, but it's also a very unique time to be with the family and very unique care to provide to patients. Come with your questions, come with your concerns, and consider what caring for a patient at the time of death would mean to you and what you would need.